Are fast approaching a major warning about a silent epidemic. More than 400,000 Australians are treated every year for non-melanoma skin cancers. That's almost one a minute. Now, they may not be as dangerous as melanomas, but they have the potential to cause horrific disfigurement and, in many cases, death. And that's why every Australian should watch this. I've spent a career inflicting my rough head on the public. But why I'm like this may save lives.
We are talking about a major epidemic in Australia of non-melanoma skin cancer. If they entrap themselves around nerves, muscles, you will lose parts of your skin. You'll lose your ear, parts of your nose. And this is preventable, Mike. It's completely preventable.
Skin cancers now affect at least 500,000 Australians of all ages every year. For the past 20 years, I've had 50 pre-cancers just on my face frozen off every year. That's about 1,000 of them. But a few of them burrowed into the skin a lot deeper and became tumours which needed cutting out. So a few years ago, I ended up with 20 stitches down the bridge of my nose. And before that, another 30 stitches in my right temple. Otherwise, they could have led to serious disfigurement. So more and more people are turning to creams to help try and prevent these tumours. And those creams can save your life, they can stop disfigurement, and they're relatively cheap. But for a little while, you do end up looking like this. 24 hours before, I was on the table. But the damage starts much, much earlier.
About 80% of your total life sun exposure, and hence the majority of the damage to your skin, is accumulated in those first 2 decades of life.
We never put any cream on or anything like that. It's a wonder more things didn't happen. We thought sun, vitamin D, that's healthy, you know, have a good tan. There was nothing to sit out in the sun for 6 hours and sunbake. Oh, yeah, I'm all red. Oh, I look healthy.
Cover yourself in oil.
That's it.
Tennis star John Newcombe spent a career in the sun. It brought him victories, but in later life, he paid the penalty. Non-melanoma skin cancers.
They don't look like anything. It's a little white spot and you think it's nothing until you go to the dermatologist. He says, oh, that's a basal cell carcinoma. I said, what's that? And he says, well, it's a cancer. I had one cut out here on the side of my nose, and 10 years later, I started getting a little sore. This is just last year. An open wound would come on the side of my nose, and I thought, oh, what's that? In John's case, it was a burrowing type of skin cancer.
Late last year, plastic surgeon Dr. John Flood operated on Nuke. The cancer had taken root and was burrowing throughout his face. John was lucky he didn't lose a lot of his nose.
Well, yes, John was lucky. In this situation, we managed to be able to preserve the nasal lining, which saved him from having really what we call a full thickness defect, or losing, exactly as you say, his right hemi nose.
What happened was this basal cell had come back here and it had grown under here, but you couldn't see it.
So what started out as a 30 or 40-minute minor operation turned into something much bigger.
Yeah, these things really need to be checked because they can just grow and grow and grow.
If you'd done nothing, you could have ended up with a big hole in the side of your face.
Yeah, and now I get checked. I get checked every 6 months. I mean, I have been for years. So they sneak up on you. All of a sudden, bang.
It starts from nothing. It can be a small scaly patch, a small lump, a small little sore that you think hasn't healed. It might even look like a cold sore, Mike, so it's very subtle.
Philip Artemi is one of Australia's leading dermatologists. And thanks to our harsh sun, he's never been busier.
We're the #1 country in the world per population for skin cancers. We're talking about a bit over 10,000 people a year diagnosed with melanoma versus about 430,000 people, 2% of the population diagnosed and treated for non-melanoma skin cancer every year.
Most of which are on your face, aren't they?
Well, the majority are on sun-exposed skin. Head and neck, ears, lips, forearms, back of the hands, lower legs. We don't want them that big, but if you neglect them, they're that big.
And something that big, we're talking serious disfigurement.
Well, we're talking surgical treatment almost certainly. We're talking about skin graft repair, and we're talking about significant cosmetic problems in terms of the appearance of the patient.
You have no idea how people can be cruel, and I've had some dreadful things said to me. Yeah. I was holding a shirt up in front of me in a shop one day to see whether the colour suited me, and a woman beside me, she said, what would it matter with a face like that, whether it suits you or not?
Dawn Johnson is the real-life face of just how much damage non-melanoma skin cancers can cause. How many skin cancers have you had cut out of you?
I've lost track. I have
You really
no
don't know?
idea. I really have no idea whatsoever.
Ballpark, 10, 20, 50?
It'd have to be more than 50.
Is that right?
Yeah. I've been through hell in the last 10 years.
Yes, you have. You've been to hell and back, haven't you?
I've been to hell and back, but it's worth it to be alive.
As a country girl, Dawn grew up under the sun. And despite having dozens of them cut out, nothing prepared her for the first major cancer on her nose 10 years ago.
It starts from nothing, or virtually nothing. Little scaly patch, and that's all. So many people don't realise that they think if it's not a melanoma, it's not dangerous. Don't worry about it. I can get it burnt off, I can get it cut out and it's gone. And it's not like that.
No one realises truly just how much they're growing, how big they're growing under the skin.
And the damage that it can do, and how easy it is and how quick it is for it to get to your brain.
The main problem with regard to future development of skin cancer is sun exposure, excessive sun exposure, particularly in childhood and adolescence. That's the thing we're doing wrong, Mike.
Being young does not mean you're safe. At only 27, Jason Kelly has already had 5 non-melanomas cut out of him. The first one at age 9.
That scar looks really good. It's well healed. There's no recurrence.
And you had 4 cut out in the last 5 years?
Yep.
And where were they?
I had 25 stitches above my left eye. Then I had another 10 stitches here, another 10 on my neck, another 5 on my right temple.
And if you didn't have those tumours cut out of your face, how may they have developed?
Well, I would have been horribly disfigured, or maybe even worse. Or maybe I would have died.
For many of us, the first option is freezing off the precancerous or cancerous cells. It can save you from the operating table.
Just make yourself comfy.
But there are other options, including acidic creams that remove the top layer of skin from your face, getting rid of any early growths.
So I can see that you've had a fair amount of sun in the past.
The procedure I chose is called photodynamic therapy. It starts with the skin being scraped clean.
So what we're trying to do here is trying to treat larger areas, and hopefully you'll get a good amount of time before you have to need things frozen off again.
Then the cream is applied.
So this is the special cream that we're applying.
And bandages put on to stop sunlight prematurely activating the cream, which needs to soak in for several hours. Then the bandages are removed and a red spectrum light turned on. It starts the cream working immediately, attacking and destroying the rogue cells. And you can feel it.
So is it starting to be a little bit stingy?
Yep.
So that's the light activating the cream.
It lasted around 20 minutes.
Now that the treatment with the cream and the light is finished, my face feels very hot. It feels as if it's stinging, but not so bad that that you wouldn't have the treatment. It certainly beats going to a dermatologist and having dozens of them frozen off once and twice a year, as I've done for years. It's certainly a simpler, quicker process. Although I'm told, and I haven't looked at myself yet, but I'm told I'm a cross between a raspberry and a tomato.
Over the next week or so, My face was filmed as the cream completed its work.
You have less risk now of developing the burrowing type of skin cancers. And the end result is less pre-cancers, better texture skin, and a lower risk for you in the future.
Any chance of looking 30 years younger, Doctor?
You do improve in terms of your cosmetic appearance, but I can tell you that the only proven anti-aging treatment is sunscreen, so we always want to keep that up, Mike.
Even if you do have basic skin cancers frozen off or use the creams, there is no guarantee you won't have to undergo surgery like this. But the best ways to prevent the curse of skin cancer are still sunscreens, hats, and regular checkups.
Please be careful of the sun, the damaging effects of the sun. And if you get a little skin cancer somewhere, go and see about it. Don't leave it.
Dawn Johnson has now written a book about her battles.
Is it hard for you to go public like this?
Yes, it is, but I really want to get the message out there. So I'm prepared to do it, to get the message. It's worth it. If I can save the life or the face of one person, if I can stop one person from ending up like I look, it's worth it. And if I can save two, that's a bonus.
Brave lady. Now, my treatment was more expensive because I wanted to lose that redness sooner for work reasons. And although some creams will leave you red longer, they are much cheaper. There's more information on our website. Coming up on Sunday.